As we age, many changes occur in our bodies. Among them, high blood pressure is something that we should be especially careful about. After the age of 50, high blood pressure, commonly called the silent killer, is a scary disease that slowly destroys our bodies without any clear symptoms. In this article, we will learn more about the risks of high blood pressure and how to manage it after the age of 50. 1. Why is high blood pressure a silent assassin? The reason why high blood pressure is called a silent assassin is because it has no clear symptoms. Most people do not know that they have high blood pressure until serious complications occur. However, during this silent period, high blood pressure gradually damages the major organs of our body. If blood pressure is consistently high, continuous pressure is applied to the blood vessel walls, damaging the blood vessels. This can lead to arteriosclerosis, cardiac hypertrophy, kidney damage, etc. In particular, after the age of 50, the elasticity of blood vessels decreases and the risk of high blood pressure increases further as it acts in combination with other health problems. 2. Shocking statistics on high blood pressure after age 50. According to statistics, more than half of adults over age 50 have high blood pressure. What's more shocking is that many of them are unaware of their condition, or, even if they do not manage it properly. High blood pressure is a major risk factor for fatal diseases, such as myocardial infarction, stroke, and renal failure, considering that a significant portion of the causes of death after age 50 are directly or indirectly related to high blood pressure. We can once again realize the importance of managing high blood pressure. 3. Risk factors for high blood pressure. The risk of high blood pressure naturally increases with age, but the following factors further increase the risk. Family history. If your parents or siblings have high blood pressure, your risk increases. Obesity. Being overweight or obese greatly increases your risk of high blood pressure. Lack of exercise. Regular exercise is essential for managing blood pressure. High salt diet. Excessive salt intake increases blood pressure. Stress. Chronic stress can cause high blood pressure. Drinking and smoking. Excessive drinking and smoking increase blood pressure and damage blood vessels. 4. Shocking complications of high blood pressure. High blood pressure that is not properly managed can cause the following serious complications. Myocardial infarction. Myocardial infarction occurs when the narrowed coronary artery, due to high blood pressure, is blocked. Stroke occurs when a cerebral blood vessel bursts or is blocked, and can lead to serious sequelae or death. Heart failure. Heart failure can occur when the heart is overworked due to persistent high blood pressure. Renal failure. High blood pressure can damage the blood vessels in the kidneys, causing kidney failure. Vision damage. High blood pressure can damage the blood vessels in the retina, causing vision loss or blindness. 5. Diagnosis and management of high blood pressure. Regular blood pressure checks are very important. After the age of 50, you should measure your blood pressure at least once a year, or more frequently if possible. If your blood pressure is 14,090 millimeters of mercury or higher, you are diagnosed with high blood pressure. The basics of managing high blood pressure are improving lifestyle habits, improving eating habits, low salt diet, vegetarian diet, reducing saturated fat intake, regular exercise, moderate intensity aerobic exercise for more than 30 minutes a day, 5 days a week, weight management, maintaining an appropriate weight, quit smoking and drinking, stress management, relieve stress through meditation, yoga, etc. 6. Importance of drug treatment. If it is difficult to control blood pressure through lifestyle improvement alone, drug treatment should be administered in conjunction with a doctor's prescription. Hypertension medications often have to be taken for life, which can be burdensome, but they are very important for preventing complications. Things to watch out for when taking medication. Do not stop taking medication or adjust the dosage without consulting a doctor. Take medication regularly and check your blood pressure regularly. If you experience side effects, consult a doctor immediately. 7. Hypertension and diet. Improving eating habits is the key to managing high blood pressure. In particular, the dietary approaches to stop hypertension. Diet is effective. Increase intake of fruits, vegetables, and whole grains. Eat low-fat dairy products, lean meat, fish, and nuts. Reduce intake of saturated fat, cholesterol, and trans fat. Restrict salt intake less than 6 grams per day. 8. Hypertension and exercise. Regular exercise is very effective in lowering blood pressure. The following exercises are recommended for people over 50. Aerobic exercise such as walking, swimming, and cycling. Lightweight training. Flexibility exercises such as yoga or tai chi. Precautions when exercising. Do not start high-intensity exercise suddenly. Do sufficient warm-up and cool-down exercises before and after exercise. Be careful because excessive exercise can actually increase blood pressure. 9. Importance of stress management. Chronic stress is one of the main causes of high blood pressure. After 50, the following stress management methods may be helpful. Meditation or deep breathing exercises. Get enough sleep. Maintain hobbies or social relationships. Get professional help when necessary. 10. High blood pressure and drinking and smoking. Excessive drinking and smoking raise blood pressure and damage blood vessels. After 50, you need to be especially careful. Quit smoking. Smoking immediately raises blood pressure and damages blood vessels. Avoid drinking alcohol as much as possible. And if you do drink, limit it to 1 to 2 glasses a day. 11. Manage high blood pressure and comorbidities. After 50, high blood pressure often accompanies other chronic diseases. The risk increases even more when the following diseases are combined with high blood pressure: diabetes, high cholesterol, obesity, chronic kidney disease. It is very important to manage these comorbidities together. You should establish a comprehensive health management plan through regular checkups and consultations with your doctor. 12. How to deal with emergencies. Emergency situations can occur due to high blood pressure. If you experience the following symptoms, you should immediately seek medical attention: severe headache or dizziness, chest pain or shortness of breath, blurred vision or double vision, severe fatigue or confusion. These symptoms may be signs of a hypertensive emergency and require immediate treatment. Conclusion: high blood pressure after the age of 50 is a serious health problem that should never be ignored. As the nickname, Silent Assassin suggests, you should always be aware of the dangers of high blood pressure that slowly destroys our bodies without symptoms. You can effectively manage high blood pressure through regular blood pressure checks, maintaining healthy lifestyle habits, and taking appropriate medication when necessary. This goes beyond simply lowering blood pressure and is an essential process for preventing fatal complications, such as myocardial infarction and stroke, and enjoying a healthy old age. Is your blood pressure safe now? How about paying attention to managing high blood pressure starting today? A healthy life begins with small interests and efforts. Don't miss this important health information. If you subscribe, like, and set up notifications right now, you can be the first to receive various health information, including high blood pressure. Your interest becomes the driving force behind creating better health content. Let's create a healthy future together.